Hi everyone, welcome back. And once again, we are here. Thank you very much for giving me a feedback of my previous videos, especially borderline personality disorder and treatment of borderline personality disorder part 2. For the last video, quite many of you have thrown a question over me that Dr. Grover, if we can have some knowledge out of you about how to date a person or be in a relationship with a person diagnosed with borderline personality disorder. Therefore, part of my today's video, which I call an indirect session, can be about wise mind theory and how to date a person with BPD. Or another question thrown over me was, I have borderline personality disorder and how I should start dating again because I really want to be in a relationship. So once again, before starting, I would like to say this recording or this presentation of a video is just for psychoeducation and not a substitute of any treatment or your therapeutic session. So please follow the mental health protocols and support yourself for proper treatment according to your case from your mental health professional. Well, we will start with wise mind theory. Wise mind, according to dialectical behavior therapy, is an ability to make healthy decision about one's life. Meaning thereby, your life is based on both your rational thoughts and your emotions. With my work experience with patients, it is very much astonishing that most of the individuals diagnosed with borderline personality disorder are above average work functioning and progressing with success in a great way. They are very successful professionally as they are very smart and they are taking very good professional decisions. But they come and they say themselves to me when it comes to any decision regarding their personal life or relationship issue or relationship, even social life, it becomes very hard for them and they lack emotional maturity and emotional intelligence, leading to unsuccessful personal relationship. That's where the rational, reasonable, logical, pragmatic mind versus emotional mind comes into conflict. Emotional mind occurs when one makes a decision or judgments based solely on from the heart how you feel. And love is all about from the heart and how you feel, correct? So please don't forget that having emotions and being in an emotional state is not a bad thing or problematic. The problem starts when your emotions start controlling your mind. And when you yourself are stuck on your own fish bait of those emotions. And you're biting and biting on the bait of the emotions, ignoring and pushing away the rational and pragmatic decisions, especially for dating or being in a relationship. And when we have overwhelming emotions, like with people with borderline personality disorder, the feelings distort your thoughts and judgments, and these distortions do not allow the rational, pragmatic mind to take healthy decisions about life. The other counterpart of wise mind theory is reasonable mind, as mentioned by Marshall Linham in 1993. Reasonable mind is the part of the decision making process that analyzes the facts, clear thinking of the things happening around you, considering the details, and then coming to a rational decision. It is more also used for problem solving approach to make decisions in everyday life by looking at all the four corners of the room and then coming to a decision. But like mentioned before, for emotion mind, too much of rational thinking with no emotions also can be a problem. So, having a balance of both emotions and rational thoughts can lead to healthy decisions about your life, especially to be in a relationship and while dating. Wise mind results from using both emotional mind and reasonable mind together. If you remember, in my last video, I did mention about a case study in which a patient of mine said she knows the pattern is repeating and all what has happened before is happening again as far as personal relation is concerned, but she has no control over it. Meaning, thereby, she is giving us a typical example of more than there is no control over the emotions, and she is taking decisions on the basis of emotional mind rather than rational mind, and is repeating the pattern again and again. So, according to dialectical behavior therapy, wise mind is similar to intuition. Both intuition and wise mind are described as feelings that come from the inner gut or the stomach area. And a very good strategy of wise mind meditation was introduced by Marshall Linhan again, in which a person sits in a comfortable place, closing their eyes, finds out at the bottom of the sternum of the rib cage, and that is the center of wise mind. So, in this exercise, we use the center of wise mind. The person closes the eyes, throws all the thoughts, all the problems, and the decisions they have to take on that wise mind, center of wise mind. And the first answer we get, without judging, analyzing, questioning, we just wrap it in the end of the brain. Continue to breathe slowly and then come back. After that, the decision or the answer which you have in your mind needs to be examined and re-examined. There are various steps which we can go through. One of them is to make note of the decision you've made and the emotions and the facts of the situation and the decision which you are thinking of taking according to the basis of your problem. Ask this question to yourself: am I considering all the facts of the situation while making this decision? And is it that I am not completely controlled by emotions purely while I am taking this decision? The second question is that, is this decision you are taking makes it feel right to you? Check it with your center of wise mind and notice how it feels. Do you feel nervous? Do you feel safe? Or you have doubts? Are you overtly excited? Are you having butterflies in your stomach? And then validate your decision if none of the above feelings are there. Now comes the question of how to use the wise mind for taking a decision for dating. Of course, while dating, feelings of love, affection, butterflies in the stomach, care, intimacy, desire to have intimacy, all are important emotional feelings, right? So, reasonable mind and rational mind has various factual questions. The first question is dating this person a reasonable decision or an emotional decision? And how I can convert this into a balanced, reasonable decision. Choose the part of emotional feelings first by asking yourself a question: do I really love this person? Do I have feelings for this person? Or I am having, or I want to have a relationship just to be in a relationship as others are too in relationship? Or is it what I want is companionship, socially to attend events, and at present I do not have feelings for this person? If the answer is the first one, that one really loves the person, and you know that the person you want to date has symptoms or diagnosis of borderline personality disorder, then we have to empower a rational, pragmatic mind to start with the relationship. So there are certain bullet points which one person needs to remember. And don't forget that the person whom you love has past experience of rejections, perceived or imagined abandonment, and is full of insecurity and fear of you abandoning him or her. Do you remember that triangle which I presented during the diagnosis of BPD part 1? Insecurity leading to fear of rejection and perceived or imagined abandonment. So, also, the other bullet point is that the person can be impulsive and have emotional issues on certain situation and might overreact on certain things. Like if you are regularly chatting or meeting your ex-girlfriend or ex-boyfriend, or discussing life too much with your opposite gender best friend. Here, to start with a relationship with the person with BPT, it's a good idea to clarify to the patient that the relationship he or she has with the other people or that best friend is a kind of just a close best friend and cannot be compared with the relationship which the person has, the love and the intimacy one, which the person has with the patient with BPD. And explain the boundaries too. to give clarity of mind. We all know that every person should need to know their boundaries of how much the other person should give an explanation of relationship with other people. But remember, it is very, very hard for the patient with BPD to understand these boundaries as no filter, no boundaries, and to have boundary issues with them. So therefore, the person have to have a clarity of mind, as mentioned before, when you are dating the patient or a person with borderline personality disorder. And if you are not comfortable and counting this as encroachment in your life, then it's not a good idea to date a person with borderline personality disorder. Another bullet point which a person needs to remember is that the person or a patient with BPT often do have some suicide or self-harming issues. And remember, these self-harming issues come up again and again when they perceive abandonment is coming or they are being ghosted. Oh, I'm going to be ghosted. So, what I suggest, being a therapist, that when you date a person with borderline personality disorder, have some knowledge about their family members, the family of the patient, much quicker than a person who's not having a borderline personality disorder, right? Meaning thereby, we all follow the process of taking a time to be introduced to the family when we are dating a person without a diagnosis of BPD. But in case of BPD, because self-harming issues are involved and family support is needed too, so it's not a good idea to wait for long to be sure about the person and to be introduced to the family because of impulsive reactions. And family needs to be also there when such impulsive self-harming issues are coming up to take care of the patient. One of the other most important bullet point which the person has to follow when we are dating a person with borderline personality disorder is, after few dates, mention this: hey honey, you need to have a regular therapy, right, with a professional involved, so that we both can have a happily maintained relationship. And you are most welcome to involve me in the therapy and with your therapist. I am ready for that. This is a very important point, that you are telling a patient with borderline personality disorder that you are there to support them to come out of this. Another important point, bullet point, which I suggest for dating when you're dating a person with borderline personality disorder, is to have a kind of a verbal commitment that whenever you are feeling insecure or you are perceiving that I am going to abandon you, before acting on it, please call me or text me and talk to me that what is the situation between both of us, and have communication. Here is there where another mindful communication of dialectical behavior therapy comes in, which can be used both by the patient with borderline personality disorder and others to carry on a relationship. Mindful communication is when we are not blaming each other and pointing our fingers on each other, but having a healthy, mindful communication as a problem solving approach. We will talk more about mindful communication and on further recordings. Another important bullet point which one should have or take into consideration while dating a person with borderline personality disorder is never ever make a standard pattern of good mornings or good night and have a phone call in the morning before starting your day, ending your day, because people with borderline personality disorder do become stuck in those patterns and make it a very important part of a relationship. And when patterns break and when not followed because of certain reasons, they become insecure and they imagine as if time is coming nearby that they are going to be abandoned because things are not the same. So that's why they come up and say, you are not the same, this relation is not same. Why? Because suddenly uh, one of my patients case, the job schedule changed and the person was finding hard to say, hey, good morning honey, hope you have a good day, or I'm going to put you to sleep on a phone call and make you feel better. So that stopped and the patient perceived, oh, abandonment is coming. So keep changing or switching your patterns of meeting each other every day, or stop the pattern of meeting every weekend, every Friday, or stay over every weekend. Because, on one hand, standard patterns can support the patient in the beginning by giving them security, but also don't forget they can count this pattern of staying over every weekend or living in a relationship as if surely it's a commitment and this relation has a future, which can be a problem because two people may not be at the same page. So, if the other party is not seeing any future and ready to commit, so meeting every day or every weekend, if you notice that the other person has left their own social life, especially, or changed the plans of life, just within couple of dates, then it's a serious problem. You have to remind to yourself and the other person to take it slow and know that such patterns of exchanging 100 texts every day and so much of talking and talking through sleep at night or waking me up, starting my day, can be a problem after some time. The other bullet points which we need to take care of is that in other cases we take a lot of time to know the person. We date the person. We have few dates and then we declare socially, publicly, especially on social media, hey, we are boyfriend, girlfriend, in relationship, right? You must have seen sometimes on Facebook or Insta, in relation, or a broken heart, or single, right? So people with borderline personality disorder, because they are going through insecurity, they prefer to have a ring on their finger or to declare on social media that they both are boyfriend and girlfriend much earlier and quicker. So if you are comfortable and very sure about being with the person who has borderline personality disorder, then it's better to commit sooner than elongating, because especially at least declaring on social media about having a boyfriend or a girlfriend can support the person or the patient. Also, supporting the patient to join meditation classes, yoga classes, which you both can go together and have calming skills and learning calming skills from your therapist. Having a couple therapy, having a healthy mindful communication can help. Some people find very hard to remain there in an impulsive situation and prefer to walk away, which can be perceived as a feeling of abandonment and ending the relationship by the patient with borderline personality disorder. I strongly suggest before taking that decision go for couple therapy. So individual therapy with the patient with borderline personality disorder is needed, and couple therapy can help when in relationship. So I suppose this piece of recording today, or indirect or session, what I call a video, was helpful. We will continue next session. Throw questions over me. I am surely going to answer back. Have a good life, fall in love, have a good relationship, and all the best to you. See you again.